So, it is lovely to see everybody. Welcome to the launch of our Gendered Data Insights Tools and Resources for Health Planning. For those of you that I haven't met, my name's Amanda Kelly and I'm the CEO of Women's Health Goulburn Northeast. And it's my real pleasure to be here with this launch and to be with you today. So if we could move on, please, Danielle. I would first like to acknowledge the traditional custodians of the lands on which we're all meeting today. And in particular, I'm on Dja Dja Wurrung country, and I would like to pay my respects to elders past and present. And I would like to acknowledge the strong, resilient and generous women of the Dja Dja Wurrung peoples and all of our First Nations and peoples. And I would like to extend that respect to any First Nations people that are joining us today. So just before we go through the agenda, I just wanted to do a little tiny bit of housekeeping. You'll notice that we're recording. We'll be putting this video onto our website and sharing it amongst our broader community. So if you're not comfortable with this, then please do turn your camera off. Otherwise, it will be lovely to see your lovely faces. We've got a fairly tight agenda today, so it's possible we won't have time for questions in the session. If we do have some time at the end, we'll certainly answer any questions we can, but please do ask your questions, pop them in the chat, and we will follow up by email afterwards. We'll also be sending along a recording to everybody with the with some notes about today's session. So on our agenda today we'll be looking at the background of the project, and then we will look at an overview of the current project. We're going to do some reflections on our project implementation, and then we'll have a panel discussion with two of our wonderful local government representatives from different organisations that have been using our data, and then we'll just talk about a little bit about what's next. So to start today, I'd just like to talk about then and now, essentially. So if we could move to the next slide, please, Danielle. And I should say, please do introduce yourselves in the chat. Let us know where you're from, what country you're on, and if you have any questions, etc. to start with, please do start with that. So applying a gender lens to municipal health and wellbeing plans hasn't always been the easiest activity to undertake. So in 2017, Women's Health Goulburn Northeast had the idea to support our local councils to do just that. We're now on the third iteration of this project, and we've become a little bit ambitious about this work. We see this work being of use not only to our local councils, but to our local health services and other organisations across the region as well. We've received some great feedback over the years from people that have used the previous iterations of the resources. And so we've incorporated a lot of that into this current version. And one of the things that we've done with this current version is we've consulted before the resources have come out, talking to people across our 12 local government areas. So this current iteration is a collaborative project with Women's Health East. Women's Health East is one of our sister organisations. They supported the work to help us develop the resources and in our consultation processes as well. So thank you to Women's Health East, and we'll be hearing a little bit from them in this presentation. So to start with, and take you through the project, I'd like to introduce Mary Rima Anthony, who is from the Goulburn Northeast team, and Mary will give you an overview of the project and the resources. So thank you, Mary. I'll hand over to you.
Thank you so much, Amanda. Good afternoon, everyone, and really thank you for being here today. So like Amanda mentioned, I'm Mary, one of the Health Promotion Officer at Women's Health Goulburn Northeast. So these vital resources we launched today mark a significant milestone in our journey towards more inclusive, gender-responsive health and well-being planning. So before I begin with the overview of the project, I would like to acknowledge the traditional owners of the land on which we gather. I'm on the lands of Wurundjeri Woiwurrung people and pay my respects to the elders past, present, and emerging. I also extend this respect to any First Nation people joining us today. As Amanda mentioned, today we are launching the third iteration of the resource. So this journey began in 2017 with a simple yet powerful question: where were local governments focusing their efforts to promote health and well-being? And where did these priorities intersect with Women's Health Global Northeast strategic focus areas? So over the years, the insights drawn from previous iterations have actually helped us strengthen the 2025 resource that we are launching today. So around the project milestone is that in 2023, we started to build on this work with a comprehensive desktop audit of all 12 local government municipal health and well-being plan. And this analysis helped us to understand the major priority areas selected and the types of actions that aligned with Women's Health Global Northeast priority areas and initiatives. So the health promotion team reviewed the early audit findings in December 2023, incorporating insights on existing relationships and connections with each local government, noting that over time, there has been multiple connections and relationships formed with all local governments at various levels. And this was a strong foundation to continue to offer support. Therefore, a key recommendation emerged. Local governments are seeking access to gender data that is tailored to their context to support and build their capacity to apply a gendered lens in municipal public health and well-being planning. So, to meet this need, Women's Health Global Northeast collaborated with Women's Health East in developing the new set of resources we are launching today. And Women's Health East has really played a crucial role in facilitating a consultation process with key local government representatives, ensuring that the insights gathered from each local government area helped us tailor the resource as relevant and practical as possible. So, through consultations and various rounds of reviews, we have developed two distinct sets of resources to meet different needs at different level. So the first is the regional health planning resource. So this resource builds a rationale for local government's role in primary prevention, specifically by providing a gendered and intersectional analysis of 10 Victorian health and well-being priorities, drawing on state and national data. So this resource is designed for a regional level, covering all 12 LGAs in Goulburn Valley and Northeast Victoria. The next set is the Gender Data Insights tool. So these are tailored tools for each of the 12 local governments in our region. They provide a localized rationale for action by highlighting key areas of inequity based on LGA data, also incorporating a determinant of health approach and taking a practical focus by providing tailored example that acknowledge each local government's gender equity capacity and size. So like I mentioned, these resources have purposely connected case studies of work and approaches pertaining to the different priorities to provide context and relevance to the various priorities. So much of what has been provided are examples from our region and driven through the many partnering organizations working jointly on population health and well-being across our communities. Can we have the next slide, please, Daniel? Thank you. So, context of the resource. These resources align with the Victorian Public Health and Wellbeing Plan. so which provides a strategic framework to coordinate efforts across geographic regions. So they also reflect the broader policy landscapes that shape the local government's legislative obligation and also health and well-being planning. These policies are interconnected and they are shaping both Women's Health Government Northeast strategic direction and also the local government planning. So the remit and legislative obligations of local government across these multiple layers have been leveraged to ensure the resources are practical, actionable, and aligned with existing policy frameworks. So, by using these tools, local governments will be able to apply a gender lens to their 2025-2029 municipal public health and well-being plans and council plans. Also, they can take evidence-based action to address key population health issues in rural communities. Also, this will help them to meet their obligation under the Gender Equality Act 2020. Can we have the next slide, please? So in the regional health planning resource and gender data insights tool, we have included all 10 priorities from Victorian Public Health and Wellbeing Plan 2023-2027. But we have categorized these priorities into 3 groups based on their alignment with primary prevention efforts in Goulburn Valley and Northeast Victoria. So the first set is the core priorities, which include preventing all forms of violence, including gender-based violence, improving sexual and reproductive health, improving well-being, and also tackling climate change and its impact on health. The next set is the regional priorities, which include reducing harm from tobacco and e-cigarette use, increasing healthy eating, increasing active living. And the last set is the companion priorities, which include reducing harm from alcohol and drug use, reducing injury, and decreasing antimicrobial resistance across human and animal health. By structuring the priorities this way, we wanted to recognize and elevate how important partnerships are for those working in population health across the region. And understanding that this is a collaborative approach this was also a priority for local governments as well. Can we have the next slide, please? Thank you. So, as we launch these resources today, it's important to remember data is not the destination, it's the starting point. And numbers alone cannot tell the full story. They must be combined with local knowledge, lived experience, and ongoing engagement with community to truly drive that change. This is especially important in our rural and regional areas where broad statistics often fail to capture the unique and complex challenges communities face. Also, we acknowledge our limitations of the available data, including the time lags and the access constraints we have. Therefore, we invite local governments to build on this work by incorporating their own data sets to strengthen and refine this body of work. These resources are the result of collaboration, advocacy, and a shared commitment to making our communities healthier and more equitable for all. Therefore, the recommendations for actions are not prescriptive, but intended to provide guidance that can be adapted to different contexts. So we recognize that local governments are already implementing a range of initiatives, and we welcome you to explore recommendations and take actions that align with your capacity, priorities, and community's needs. I encourage each of you to explore these resources, integrate them into your planning, and continue these conversations within your councils, organizations, and communities. Together, we can definitely create a lasting change. And thank you so much. And with this, I will hand it over to Catherine Lim from Women's Health East to talk about a few reflections on project implementation. Catherine.
Thank you so much, Mary, for that beautiful overview. I learned so much from that process being, coming in relatively recently to the project. Thank you so much for the opportunity to share. My name's Catherine. My pronouns are she and her. I'm the team leader for gender equality at Women's Health East. As Amanda mentioned, we're a sister organisation of Women's Health Goulburn's North East, based in the Eastern Metropolitan region of Melbourne. And as Amanda mentioned, we led the development of these resources, and we also led the consultations with local governments across the region to make sure the resources are genuinely practical and useful for council contexts and for municipal health and wellbeing planning. So a bit about the consultations themselves. We conducted 11 in total out of the 12 local government areas, and these were councils across the Hume region. We had really focused conversations. So to conduct, I should share that my implementation reflection will be mostly about the consultation process today. So we shared early drafts of the resources with councils alongside specific questions which highlighted any particular points of data that we found interesting or needed further explanation, and specific questions around deepening our understanding and deepening the usefulness of these resources. Councils were incredibly generous with their time amidst really busy schedules towards the end of last year. And the conversations were super rich, and we had gained so many insights about questions, emerging trends, policy issues, and sticking points with regards to the resources. So we heard a lot of things. We did hear some great initial feedback about the resources. From councils, we really loved, as Mary mentioned, that they filled a key need in terms of detailed insights and analysis of data, particularly around things like women's safety and sexual and reproductive health. As Mary mentioned, really provided that gendered and intersectional analysis of data. So data only being the starting point, adding in sort of what we know from best practice, from research, and kind of reflecting it back in one place. Councils also really liked the strategic nature of the resources and also their potential to be used as a communications piece across council and to drive change. And seem to really appreciate the snapshot of seeing your own local government area sort of highlighted amongst the region and the state averages. There were also some really interesting themes for feedback coming out of the consultations, things that we could improve on. So in particular, a lot of people highlighted the need for these resources to be really practical. Council, local governments are facing huge challenges at the moment, both in communities and within councils in terms of resource constraints, structural restructures, people holding large portfolios and doing a lot with a little. There was a big variation in the councils that we spoke to, so this is definitely the case for some more than others. But definitely the need for resources that is practical and can really respond to the day-to-day realities of council and be flexible as those priorities change. In particular, there was some interesting perspectives around the case studies as well. As Mary mentioned, we highlight some specific examples of the different local government, the health and wellbeing priorities, and examples of things that people have put into practice, and really through the consultations try to make them sort of a lot more tailored and practical, using a lot of examples from the Northeast. People had also highlighted the purpose of these reports, not just as sort of pieces of research that sit on a shelf, but really things that need to be socialized across council and accompany the more like perhaps action-focused nature of the plan. So they're tools to, explain some of these concepts around applying a gendered lens, applying like intersectionality, a social a model of health to newcomers in council, also at a high level to councillors. A lot of councils had recent council elections, new councillors coming in to help understand the context of the work. Quite a number of people highlighted emerging issues like gambling, and also some factors that are not reflected in the data yet. So impacts of, cost of living crises and housing shortages and bushfire recovery, which have all sort of really happened since some of the like big data sources we were collecting from, such as like the census, and they were not necessarily reflected, but they were really helpful sort of context to incorporate. People talked about wanting to really understand their legal and compliance obligations for gender equality, particularly under the Gender Equality Act, and to sort of not have that as the minimum, but to make that more clear. Amid resource constraints, really wanting recommendations that were strategic and could have the most impact for the resources that we had. So perhaps rather than one-off activities, ways that there could be partnership or sort of like alignment of these kind of incorporation of some of these principles into wider council planning to really challenge structures and systems over the long term. So based on some of this feedback, we listened and learned, and we the final resources shifted quite a bit actually based on some of this feedback. We streamlined some of the demographic information up front, which was like data that councils use quite often. But we sort of like really dug into our area of strength, which is that gender data analysis and, the hard-hitting facts around the prevention of violence and things like that. We improved the practicality of our implementation pathways and created like clearer connections between data and potential council actions. We took into consideration some of these future trends at play. These were in the resources beforehand, but we did analyze population trends over time so that the resources capture not only what's happening now, but what will happen in 10, 20, 30 years time. We realize we use a lot of jargon in the women's health space and in the field of like sexual reproductive health, violence prevention, and things like that. And we really shifted to more of a translating role with these resources. So how can we decode some of the language in that, the evidence base, the research and best practice around this work, and really sort of put it in a language that people in council can work with day to day. We also provided specific opportunities around partnership, aligning with existing resources, planning and things like that. So if you are here and you're one of the people that myself or anyone from the team spoke to for these consultations, thank you so much. I think we have shared back some early drafts of these with our contacts in most LGAs, and I think the feedback has been really positive. We'll hear from Tegan and Mark later in this talk, sharing some reflections about how they're putting some of these resources into practice. But before I wrap up, just a few insights on the process from my perspective at Women's Health East. And I must admit, I'm from outside the Hume region. I'm new to Victoria, from New South Wales originally. I'm also relatively new to the Women's Health Services, coming in over the past few months from more of a different sort of prevention space. But really, first of all, like the opportunity to have these conversations and really dive deep into some of these issues with councils was a huge privilege. And it just really highlighted for me the benefits of this cross-pollination. And when those conversations are like meaningful and honest, and people are not afraid to ask the hard questions, I feel like it's just really helps both sides to learn from each other, and really strengthens what can be achieved overall. As Mary mentioned, data was only the starting point, and these conversations really enriched our approach and understanding. Local context really mattered. So, just in terms of picking up on some of the emerging trends not captured, what's going on in migration patterns, not what's going on in, yeah, like, and also just like the interrelations between LGAs in the region. Like, quite a few people were highlighting some of those nuances between like the regional hubs and the rural areas, and sort of like the ways that those things kind of interplay. And we were able to sort of incorporate that into our gendered analysis. Yeah, and for me, yeah, it just did highlight the complex and interconnected nature of these issues, and the importance of having resources readily available that can sort of highlight the issues at hand. And it also did highlight for me just like the role that women's health services can play in collaboration with local governments, and with population health promotion in general, just in terms of being that important sort of linking factor between the data that exists, the best practice that exists, the research that exists, and the issues that are happening on the ground. Translating, like meeting you right where you're at, and bridging that theory and practice. Bringing in specialized expertise and local contacts. So just like people sort of having these contacts with sort of like diverse women in the region, and sort of in my work as well, and being able to bring back themes, not just from the research, but from what we're hearing in the community and in people's lived and living experiences as well. And yeah, just the strength of that partnership and collaboration. But yeah, that's all from me. And yeah, I'd now like to introduce Renata Lucas, Regional Manager from Women's Health Goulburn North East, who will lead reflections from the sector discussion.
Thank you. Thank you so much, Catherine. It's been a really lovely way to, I suppose, close that feedback loop on our local government consultation process, to have it featured in our launch today. And you are right, the initial version of the first draft of these resources, I think, has been a complete flip around from what we ended up with, and it's for the better, because it's so rich, and particularly those, I was really excited about the actions that have come out and that have been tailored with local government input. So here we are to now talk about the theme of putting it into practice, because we're really keen. That's probably one of our primary goals. We want it to be practical, we want it to be useful. So now joining me to have a bit of a discussion about what it might be looking like in practice, or what it's what the future holds for these resources, is I'd like to welcome two representatives from the local government sector to provide some further reflections. So joining me is Tegan Harris, Coordinator of Community Development and Youth Services at Mitchell Shire Council. And also we have Mark Florence, Director of Community and Planning at Towong Shire Council. So thank you so much for being part of our panel discussion and part of our launch. I'd like to maybe, Tegan, if I can start with you, whether you could give us a general overview of Mitchell Shire Council for those that may not be familiar with your area, and from your experiences, what some of the key health and wellbeing considerations are for your community.
No worries. Thanks, Renata. I'm Tegan. Hi, everyone. I think I know most people online today. So I would just like to firstly acknowledge that we acknowledge our traditional owners, who are the Taungurung and Wurundjeri Wurrung people. They are our traditional owner groups in the area now known as Mitchell Shire. So I'm working on Wurundjeri today. I guess a general overview for those who might not be aware of where Mitchell sits. So we sit approximately 40 to 100 k's north of Melbourne CBD. We have the southern end of our shire, which includes suburbs such as Beveridge and Wallan, and we reach right up to the northern end, including Broadford, Seymour, Pylong and Tullarook. We currently have, I think, 61,000 projected residents in 2024, and we're constantly growing. So we're looking to have 176,000 residents in 2041. Some of our key health and wellbeing considerations. So we are currently working through our updated municipal health and wellbeing plan at the moment. We're also dissecting some data that council had recently taken in consultation with community from a household survey, which was done in June and July last year. And included in all of that is also the updating of the health profile. So we had our last data set before these resources were created from 2017 and 2021. So I guess some of our key health and wellbeing considerations that became up really important to our community previously was physical and mental health, community safety, and the perceptions of safety, family violence, gender equality, and I guess the community attitudes to some of that work as well, food insecurity, and climate change. So hopefully that's enough of an overview for us.
Wonderful, thank you. Very broad but interconnected range of priorities and considerations there. And so, Mark, what about you at Tauranga Shire Council? We were reflecting before the launch on how different these two councils are in terms of geographics. What are some of the key health and wellbeing considerations you're facing?
Thanks, Renata, and good afternoon to everybody. I too would like to acknowledge the traditional owners on which we gather and pay our respects to elders past and present. Tauranga is an interesting place. For those who may be not sure where Tauranga is, it's nestled in the northeast of Victoria. So basically, if you go up the Hume Freeway, you hit Wodonga and you turn right and make your way up through places like Tallangatta on the way to the Upper Murray and Corryong. We are very small and very remote. So we have 6,000 population across 6,000 square kilometres. So the biggest geographical local government area in Victoria. And our two principal towns are Corryong with about 1,400 people and Tallangatta of about 1,200 people. And then we have the rest of the population is made up of very small communities like Mitta, Dartmouth, Walwa, Belbridge, etc. So the population makeup is, quite old. So, more than 30% of our population is over 65. And we have a very large gap in between. So our early years, so from 0 to 5 is fairly consistent. We have fluctuating numbers of teenagers or young people. And then we have this very large group at the other end of the scale. So our health and wellbeing needs are quite varied, exacerbated by the remoteness and the rural nature. Different to perhaps Tegan's experience of, large population centres, but also the proximity at the southern end of Mitchell to, the peri-urban growth of the northern suburbs of Melbourne. So some of our challenges are some of the particular issues are no different to Tegan or others in terms of mental health, violence, and obesity, alcohol use. All of those different things are common in Tauranga. The challenge we have, I suppose, is particularly in the Upper Murray area is the access to services. So whilst we can identify with the use of the data, and I'm talking generally at this stage as opposed to just from a gender perspective, we can identify all the various issues and challenges that we face and what the data is telling us. It's what we do with that after is the challenge. So our health services are particularly stretched, and we as a council are particularly stretched in being able to deliver any of the needs that our communities have. So that is a particular difference, I think, between places like Mitchell and Towell. Hope that helps.
Yes, thank you. Thanks for that overview. And yeah, and I suppose that puts a very particular context on whilst we've developed 12 local government gender data insights there, the way that they're put into action or put into practice may look very different. So Mark, in having a look at and reviewing the gender data insight tool for Towell Shire, what do you have some examples of how you see your local government being able to use it?
I think the trick for us, Renata, is I mean, as you've heard me say to you in other forums, that I'm really impressed with the work that's been undertaken, and particularly the level of detail in providing some practical examples of how initiatives might be delivered or focus areas for council. I suppose for us, with our limited resources, and one of my colleagues is with us on the meeting today, we've introduced a culture and inclusion position at an officer level, but that has responsibility for youth, arts, First Nations, LGBTQI, libraries, ageing, all of those sort of things. And this is a 4-day-a-week position. So we have all this information, and the gender tool is really important and gives us the data and gives us the opportunity to then test that against our local knowledge. But we have the same, same level of information in our First Nations space. We have the same information in our LGBT space, arts, etc. It's how we reach a position where we've looked at each of those and seen and come up with ways that we can cover a lot of bases with one effort or with our limited resource. I hope that makes sense. So there's a lot of intersecting across the different cohorts. And in this case, women are obviously represented in all those cohorts. So how do we look at the LGBT IA plus cohort and the work we do there and have a gender lens through that at the same time? So what I'm saying is our challenge and the way we will approach it is to try and look at all the cohorts that we need to address, and how do we bring a gender perspective to that, as well as access, inclusion, opportunity, education, employment, all the things that go to contributing to good mental health, for example. And good mental health equals potentially less substance abuse, and less substance abuse leads to less violence in families. All of those different things. How do we connect all those bits together?
Lifting it up. What I'm hearing you say is like lifting it up to the systems level to see where the point is that can filter across many of your
That's
obligations.
Right. Yeah. So for someone like Tegan, for example, or bigger regional centres, they may be able to chunk off specific portfolios and have some dedicated resource in, whether it's youth or arts or recreation or whatever, whereas we don't have the luxury of that. Not saying that Tegan has either, because she would have her own challenges, and there's challenges in Mitchell that I wouldn't want to go near.
So yeah, Tegan, what are some of the examples that in terms of how you might how you're using or approaching the gender data insights tool?
That was
Yeah.
a good segue, Renata and Mark. I think one of the most obvious examples for us here at Mitchell is council planning. So I think I mentioned, we're currently undertaking the new municipal health wellbeing plan at the moment and the new health profile. So we've been able to use it so far around ensuring that our services and programs are all designed with that gender sensitive approach. I think the tool helps us to understand specific health needs as well of women and men, because I thought there was a really good comparison and gives that other insight to the view of gender equality as well. I think offering women focused mental health support or creating programs that address men's physical health, for example, specific to Mitchell, is probably one way that we're looking to use it. I think from like a policy level and, probably off the back of what Mark was suggesting as well, being able to have the data and highlighting those like disparities between the genders as well. I think that's just going to help inform decisions around resource allocation or, what programs are we prioritizing in line with our, on the ground staff and our portfolios, but then, how does that align with our other plans, such as our gender equality action plan and things like that. So we're not probably as rural or remote as what Mark is experiencing, but I think as well, on the flip side of that, we do still have some gaps in service provision in Mitchell Shire. So, we tend to have a lot of outreach services that will come to the Shire, which is really great. Keeping those services and advocating for those services to stay here is another part of that as well. So hopefully that answered the question.
Yeah, wonderful. Yeah, and maybe one final question, just as we're getting to the end of our discussion. I think you've already started to touch on how the tools are being used as part of your municipal health and wellbeing planning, but also council planning. But I suppose I'm interested in finding out from you how this enables you to apply a gender lens, like without these resources. Yeah, how would you what does this give you, I suppose? It's not a very clear question, but yeah, just in terms of wrapping up, I suppose, what difference do they make? Maybe that's
to be
more
blunt, Renata, we would struggle without them. Yeah, so to have a relationship and a connection with your organisation is of huge benefit to us in terms of our strategic planning. I think that's really important, and that's where I think the maturation of Women's Health Goulburn North East, for our case, has been really useful in providing that strategic and data-driven approach, but also now to give us the opportunity to look at some of the recommendations and say, basically it's a menu for us to say, I'll have one of those in our council plan or our health and wellbeing plan. And then also, I think, just to finish up, I think the real crux, and it's been highlighted, is the local context, and how you test what's in the data against the local context. And one quick example for us is we know in Corryong that there's data about, some family violence, particularly after the event of the bushfires. But that's been reflected in our MCHs, our maternal child and health nurses, who are actually seeing some of the, the trauma or the examples. So that is a way we can test the data against the local context, and that's really important when we come to our making decisions about where do we put our resources.
great example, thank you. And for Tegan, Mitchell has been quite a long-term partner with Women's Health Goulburn North East, and so for you, what difference does these resources make?
Yeah, I think just piggybacking off, Mark's comments as well. So far, it has provided some really clear gender-specific data. Maybe, the tools allowing us to identify and readily kind of address, the differences between genders and how that looks for our LGBTIQ plus communities as well. But kind of really filling a resource gap in a way, because I think we've both probably touched on resources enough. I think as well, you know, off the back of planning processes and strategy, the resource is really helping us almost challenge some of those assumptions as well, and bring a more nuanced understanding, I think, to the planning processes and what that looks like around applying a gender lens, you know, ensuring that policies and services cater to all genders equitably as well. So that's been something that's been really great for us so far in some of the conversations we've had internally. I think, you know, reflecting on some of the stats and the data in the tools, you know, for us in Mitchell Shire, mental health, it's no secret around service provision. It's a key gap for us. It's one of our key growing advocacy spaces as well. Having the data highlighted and having a gender lens applied to that as well, really readily available, has started to help us kind of accelerate some of that work that we're doing in mental health. So, you know, back to local context, having it as a reference point that we can also share across council, you know, take it to council strategy and really kind of have that whole council approach has been really useful. And you guys did it for us. So that was great to have that partnership. You know, we've obviously partnered on a few different things now, and we're just, like Mark, feel really lucky to have a health service that's really proactive in this space.
Thank you. Thank you both. Yeah, both Tegan and Mark, thank you so much for sharing at our launch today and being part of it, and celebrating the partnerships and the relationships. Your contributions and input, not only today, but throughout the consultation process, and that goes for all the local government key contacts that we talked to, as you heard from Catherine earlier. It has made such a difference to the final resources, and yeah, really look forward to working with you both further into the future. So thank you so much. I will now hand over to introduce my colleague Megan Hunt, the Health Promotion Officer at Women's Health Goulburn North East, who will provide an overview of the next steps. Thanks, Meg.
Thanks, Renata. Really interesting listening to both you, Tegan and Mark. Thank you for your input. So yeah, I'm just here today to cover a bit of, you know, thinking forward and where to beyond the resource. And so just going over a few things that we've been learning through this process that Catherine kind of covered earlier as well. We know that many councils that lead municipal health and wellbeing partnerships and networks that are already in existence, that actively engage organisations and community groups, many of you who are on the calls today, that steer the delivery of the delivery of the local health and wellbeing plans. Our organisation is already an active member of many of those, and so, you know, if your council is looking to establish or reignite an existing kind of network in that space, you know, Women's Health Goulburn North East would very much love to be part of that. So we do encourage you to reach out to us. We are here as a partner organisation to all our local governments that we serve. And also, we have already been involved in a number of local government consultation processes that are underway already. So, and the developer of municipal health and wellbeing plans, and many of you are also incorporating that into your council plans. So we continue to welcome that opportunity to be further involved in these processes. So just keeping that door open. We're here again, that message, you know, we're very much a resource to be a part of those consultations. So we really value that opportunity as well, to be part of any reviews as well along the way. So obviously there's drafts to come and things like that, and we'd love to be part of those processes, and, you know, offer you some feedback and support there along the way, kind of touching on what you were saying before, Mark, there as well. We're here. So this is not one and done. This is you know, an ongoing offer to continually be part of it. Beyond that, some other supports and things that we can offer as an organisation to you. We provide presentations for staff as well. That's another offer we have, if that's something that's required in here, to kind of get an understanding more so of some of the content and the context to those resources that we have.
And we have e-learning modules as well. We do a lot in that space, and that can be found through our website. There's a link in our Women's Health Goulburn North East website that will take you to that. And that's publicly available and free, what's on there. Beyond that, also, there is an opportunity where we can tailor certain training courses beyond what's available there. So if there's something specific that your organisation needs, we do encourage you to reach out and have a conversation with us about that. That's something that we very much are here to offer as well. And also, if there is anything in supporting your organisation around aligning those obligations around the Gender Equality Act, that's, part of our role as an organisation is to support you with that. And, whether that is something quite specific that you're needing help with, like a plan or a piece of work, or it is something that's sort of an overlay that you're looking at a longer term piece of work for your organisation, we're here for that as well. So yeah, just reiterating that point that we're happy to help where we can, where the door is always open. And we see this resource as very much part of the journey of supporting your organisation and our local areas, our communities, and really working together. So yeah, that would be fantastic. Amanda, I'll hand this back to you for your final words. Thanks very much.
Almost did it, almost forgot to unmute myself. Thank you so much, Meg. This has been great. Thank you. I think that it's been, I've learned things that I didn't realize before. And so I think that that's the power of us working together, is learning from each other in this space. And we're very much here to learn from our partners as well as to share what we know with our partners. So thank you so much. Thank you, Mary, for the fantastic overview of the project. Catherine, for your reflections on our consultations with people. And thank you, Renata, for leading the conversation. Tegan and Mark, it's just such a joy to work with you and with your organisations, and is a joy to work across our region because we have such diversity, we have such talented people. Our local governments are the backbones of our community, and it's so important that we work together in this. And I really am truly honoured to be able to work together on these projects. And as Meg said, we're here. We've been here, we celebrated 30 years a couple of years ago, and we plan to be here for the long haul. So as Meg said, it's not one and done. It is an ongoing offer, and it would be a pleasure to work with people continuing and ongoing. So I believe that we're going to pop in the link to the reports themselves for people, but we will, of course, follow up with an email for everybody that's been here today with links to the resources if you haven't seen them already. And I think the other thing to note is that these are useful not only for local government, but they are useful for our health services, our community health services, for other organisations, sporting clubs, etc., across our regions. So please share them far and wide. They don't have to just sit with local government. It would be wonderful to have them shared right across our region. So I'm going to wrap up, and I'm going to say thank you so much to everyone that participated in our presentation today. But thank you so much for being here and being online. It's so lovely to see familiar names and faces, and some new names and faces as well. Really appreciate your time, and thank you all, and we'll see you around. Thank you so much. Goodbye.